Good morning, everyone, and thank you for being here today. May is Mental Health Awareness Month, and we feel it's an important time to address what's going on in our community and the mental health crisis that we are, in fact, facing. So last year, we shared with the media and the community the growing children's mental health epidemic we were facing with a virtual event called Unmasking the Epidemic. So today I'm joined by leaders of Lee Health Golisano Children's Hospital who are going to provide an update since last year to talk about the progress that's been made, the plans for the future, and how we need our community to partner with us to advance the change in this region. I want to acknowledge the community mental health providers who are joining us virtually for this support and advocacy. Community partners have continued to advance mental health care solutions for youth and their families in Southwest Florida, and we will outline this in the presentation today. Even with all that's been done this year, we are still seeing alarming numbers that bring us together today, united in our priorities, and that's the mental health and well-being of our children and families. I want to now invite Alyssa Bostwick, our Chief Nursing and Operations Executive, up to share an update on Golisano Children's Hospital. Alyssa?
Thank you, Dr. Antonucci, and thankful that the noise stopped for me to come up here. Prior to the COVID pandemic, our team knew that we were in a serious pediatric mental health crisis. We saw an escalating need for our outpatient mental health services, and we saw a rise in children coming into our emergency department with the intent to harm, and a rise in our suicide rates as well. Now we are 2 years into the pandemic, and those numbers have only continued to increase. We have seen a 221% increase in children coming into our hospital under the Baker Act from 2019 to 2021. The Baker Act is a Florida law that enables children, anyone actually, that is having a mental health crisis to receive the help they need in a hospital. If we annualize our numbers this year, we anticipate that we are going to see 1,254 children that walk through our doors under the Baker Act. That is a 36% increase from last year. While those numbers are daunting and sobering, each one of those numbers is a child in need, and as a child as young as the age of 5. Several months ago, we had a 5-year-old come into our emergency department with thoughts of harming himself. It caused our team to pause because we asked ourselves how a child as young as 5 could possibly be having those thoughts and those feelings. As our team spoke to him,
Code red drill, all clear. Code red drill, all clear. Code red drill, all clear.
As our team spent time with him and spoke to him, he opened up to one of our physicians and let her know that he had been listening to his parents talk about their financial struggles, the potential that they could lose their home, and the inability to potentially put food on the table. This little 5-year-old internalized that and said, "What can I do to help?" And he landed on, maybe if I wasn't here, they wouldn't have such a burden. And that's what brought him into our emergency department under the Baker Act. Additionally, our outpatient visits have increased. In 2017, we had about 1,100 visits in our outpatient mental health department. And this year, we're on target to see well over 18,000. That is over a 1,600% increase in those visits in the last 6 years. Last year, we had a wait list of over 600 pediatric patients waiting for mental health services. And thanks to the generosity of this community and the dedication of our team and the growth in our mental health services, that wait list is down to less than 90 today. To talk more about the progress that we've made, I'd like to welcome Dr. Salman, our Vice President of Operations and Chief Physician Executive and Regional Medical Officer for Pediatric Services.
Good morning. The mental health crisis is real. This is a problem we knew has been festering for the last several years, and the COVID pandemic has just brought it up to the surface. We've continued to increase our services to provide access. In 2016, we had 6 providers that were taking care of our children with mental health issues at Golisano Children's Hospital. Today, we have over 37 providers doing that job. That is an over 500% increase in the numbers. We've added 2 full-time social workers in our emergency room, so we now have 24/7 coverage for social services within the emergency room to try to deal with the Baker Act issue and the number of kids that have been diagnosed with a risk to themselves or to their family members. We've also implemented public safety rounds with a 24-hour critical incident debrief after every incident. That way, we can try to address the issues and we can learn from our patients what needs to be done the next time we're faced with the same issue. We're also adding psychologists in several of our specialty offices. We found over the years that children with chronic illnesses, be it diabetes, cancer, cystic fibrosis, have an increased need for psychological services. This year, we added psychologists in our endocrinology office, as well as for children with cystic fibrosis. Our plan is to continue to do this with other chronic illnesses, that way those kids will get the services they need sooner rather than at the time when they reach a crisis point. We are also adding inpatient care navigators. We added 1 this year, and most of you are aware that we have several navigators within the school system. Our team recently completed a therapeutic crisis intervention training that way they can handle patients who are acting up and to be better skilled to take care of them during those crisis moments. We also added a special kid-friendly safety vehicle for our public safety team. And some of you may have seen that driving around town. We're taking steps to grow as this community continues to grow as well. We've trained a behavioral response team. We plan to become an autism certified center over the next year. So Golisano Children's will be one of the few in the state that are autism certified. We're expanding our services. We want to take care as close to home as possible. Over the next year, we plan to open 3 offices, 1 in Bonita, 1 in Lehigh, and 1 in Cape Coral, where we'll have psychological services available for our patients. And in about 2 years, we'll open a second one in the Cape Coral area, where the population continues to grow and there's a growing demand for care for services for children. We're also working on an autism testing center, which we hope will be up and running within the next year. These programs and services, as well as expansions, are made possible through the generosity of community members to Kids Minds Matter. This year, the WASI Foundation had a challenge grant of $1 million to help fund mental health services, and we're happy to say we were able to make that challenge grant to Kids Minds Matter and its generous donors. You heard from Melissa about the number of patients with Baker Acts. Over 1,000 patients, that's about 3 patients a day that are brought in for Baker Acts, which means they're a danger to themselves or danger to family members. So we're barely scratching the surface. Even though we've gone and increased the number of services available by over 500%, we're just seeing the tip of the iceberg. We'll continue to try to meet the needs of this community and to have a full continuum of services for our patients. Child advocacy is a big part of this, and to help explain that further, I would like to welcome Richard Killen to the podium.
Our child advocacy team provides training and education to keep children safe. Proactive mental health programs are critically important to ensure challenges are addressed before a crisis occurs. We've made it our goal to train and educate caregivers and leaders in our community with free training. In 2021 and to date in 2022, we have trained more than 520 Lee Health leaders and staff, 120 community members in mental health awareness. We've trained 322 external community leaders, plus 220 Lee Health leaders in mental health first aid, which is a 3-year professional certification in both the adults and the youth modules. This training helps people be able to assist someone experiencing a mental health or substance use crisis, including risk factors, warning signs for mental health and addiction concerns, strategies for how to help someone in both crisis and non-crisis situations, and where to turn for help. We've trained over 106 caregivers through programs like Dignified Discipline, Parenting the Exceptional Child, which is our 8-week parenting class for parents of kids with special needs, including behavioral health issues, and Understanding Education. These classes help parents and caregivers learn to manage their children's behavior in a way that both maintains healthy relationships and changes inappropriate behaviors, and in the end, hopefully can prevent some of the concerns that we have for those children coming here under the Baker Act. Additionally, we provide peer support groups for both parents and youth. We are fostering the youth and family voice to improve our service delivery system here in Southwest Florida so that those who receive services can have input into what those services look like. Our Mental Health Navigator program is one of our most successful. Started as a pilot program in Lee and Collier schools and the healthcare network down in Collier County. The Mental Health Navigator program exists to provide peer mentoring and supports for families whose children face mental health challenges. We are bringing to Southwest Florida a national evidence-based program that has proven effective because we've also adapted it to the special needs here in our community. This specialized program is specifically for the most challenged children and families who are referred from the schools and have not responded to school-based interventions or interventions through the health care network. Ideally, every school in Lee and Collier County would have a mental health navigator, but expansion of the program is limited by financial support, as currently this is not reimbursed and is fully supported through Kids Minds Matter. Since we've opened our doors 1 month after the start of the pandemic, we've helped over 150 families. And some of the results in just 1 quarter, children improved the grade performances by 15%, math grades by 12%, and we've improved attendance in a quarter by 55%. This is a wraparound approach, which is a coordinated approach where we bring all of those child servicing agencies together to row in the same direction and always with the family present, so it's that family's plan. And we do an amazing thing in instead of telling families what they need, we ask them, what do you need? And how can we make you and your child's life better? And I see one of our families shaking her head. Thank you. We connect parents to mental health services. We work on transportation issues and providing transportation if that's what we need to do. We help complete applications side by side with the family for housing, financial assistance, and school enrollment. Helping families who are food insecure access local food resources, and in emergencies we'll provide that food. So it's hard to think about your child's mental health when there's no food on the table. Anything that helps increase the family's access to services and resources, that is what we do. We work with the whole family. We don't just work with the identified child. Actually, right now we're averaging for our identified families, 3 members of the family have mental health issues, and we get services for parents, siblings. We really work on the whole functioning of the family. Just anecdotally, I'd like to share that recently the Collier Community Foundation funded one of our positions, and they vetted us incredibly thoroughly. We found out and heard through the grapevine they were talking to everybody we've worked with. And when they came back to say they wanted to fund one of our positions, they said, everybody loves you and everybody had positive things to say. And we checked out your research and evidence base, and you know what you're talking about. I'd now like to introduce Dr. Paul Simeone, Vice President and Medical Director of Behavioral Health at Lee Health, as he's going to talk about some of the more regional programs that we're also working on.
Thank you, Richard. Good morning, everybody, and thank you very much for taking time out of your busy schedules to be with us today. As you've heard, there's a lot of great things going on at Lee Health and behavioral health, and I have the pleasure of adding to that list some of the things we're doing in the community for our individuals, our kids, our families, and the like. This journey began in earnest in July 2018 when Lee Health hosted the very successful Syntegration event. This brought together 65 community leaders to address what could be done to change the behavioral health landscape over the succeeding 3 years. While there's still much work to be done, I'm happy to report that we have more than met the goals of that conference, which are increasing access to care, as you've heard about today, reducing stigma, that terrible discrimination that we hold against ourselves and people hold against us when we have mental health problems, and developing a strategic plan for the region's behavioral health and substance use disorder services. I'm going to start with the strategic plan, but I first want to make a few comments about community collaboration. When I arrived here from Boston roughly 3.5 years ago, I heard much about how siloed, segmented, and non-collaborative was the behavioral health service community. I actually don't think that's the case at all. Instead, what I found is that the region lacks effective ways to come together, which in the main is a microcosm of the fragmentation we see in our society more generally. That's where I started. To me, if people are going to come together to address common problems, to create what sociologists call social capital, there must already exist a ready infrastructure to serve this vital function. That's been and continues to be our approach to this challenge, anchoring our efforts in population health, that concept that really ballyhoos, and asks the question, how is it that you take care of people in a population? How do you take care of communities? And how do you do it thoughtfully, paying attention to good patient care, but also what the contours of a population are that we need to pay attention to? This is really our vital vision. So here's what we've done and what we're doing. First, from the point of view of strategy, 2.5 years ago, I, along with Judge Sweat, started the Ad Hoc Regional Strategic Planning Council, which was a project that was really meant to create a 5-year strategic plan in behavioral health for the region. As much as we do here at Lee Health and many of our collaborative partners do on their own, what's become clear to all of us is that we need to put together an integrated system. And so over the last 2.5 years, 27 different agencies got together, spent over 2,000 hours putting together a white paper that was recently presented to the Board of County Commissioners. We've gotten their support for this. Just as a sort of fortuitous event, during the process, the American Rescue Plan Act money filtered into the county, and we have just recently applied for a $5 million grant to stand up a completely integrated behavioral health regional system that will partner with as many agencies as we can get to do so. At the moment, we have 42 letters of support supporting our application. That will be decided in June, and if we can get this across the finish line, this will be the most important thing that we've done down here since I've been here. It's absolutely critical, and I think this will become a national model. We are working in partnership with Collaboratory, FGCU, and United Way, and the 4 partner organizations collaborated in writing that grant proposal. Secondly, I want to tell you just a little bit about the events we sponsor. This is not this is a comprehensive, but it's not, it doesn't list everything we've done. these are important places. When I talk about creating infrastructure, you have to have places where people actually meet, and that's important not just for providers, but it's also important for patients. So Normal is Overrated is our annual student-led conference that addresses the issue of particularly adolescent and young adult mental illness. It's my favorite event. If there are people here who haven't been to it, you should come. It will be in September again, I think. I think it's September. It's the most amazing thing to watch these kids get up and talk plainly about what they're struggling with. And we're talking about relatively serious issues. And people, these kids present it with a level of courage and sophistication that's just incredible. We have our upcoming mental health fair on this coming Friday at Collaboratory. This is a sold-out event. We started this 3 years ago, basically in the back of a napkin, where we started to talk about, hey, we should get together. Nobody really knows what's going on in the community with various agencies. It is now sold out. We have 225 registrants, 50 vendors, and 42 agencies who want to come and talk about stuff. Basically, that we're going to get together. We're going to have, food, drink. People will have an opportunity to hear what's going on in the community. And again, this is one of those places where, it's like the village square. We need more village squares for people to come and talk about what's going on. We also put together a Recognizing the Unrecognized event last month, which celebrated our first responders and really addressed the stresses and strains on families and individuals and how we can help. That was so popular that they've asked us to do that again next year. In June, we have an upcoming event on Pride, Not Prejudice. This is a sponsored event for the LGBTQ plus community, both for providers and for patients, individuals. This is something that we're wanting to do for a long time. And then finally, in September, we are going to help debut a film by a local African-American documentarian, Antoine Lindsay, who is going to present his new work called Hush, which addresses mental health issues in the Black community. We're really excited about that. So these are all things that Healthy League, Kids Minds Matter, and many other sponsors are putting together. Again, not an exhaustive list, but a sampling of what we've been doing, mostly to build infrastructure and to talk with people about what's going on. And then finally, to address the workforce shortage issue, most of you probably know that Southwest Florida is a federally designated workforce shortage area, which means it's very difficult to recruit people down here for a variety of reasons. The cost of living is probably the biggest one. So what we've decided to do is to build out as many training programs as we can. When I was in Boston, I spent a lot of time in training all manner of mental health people through a variety of jobs that I had. And so training is very near and dear to my heart. So what we've set up thus far is we have a Kids Minds Matter Scholars Program, which provides $10,000 scholarships to 10 super talented graduate students in the counseling program who have demonstrated an interest in sticking around and also doing pediatric behavioral health. That's become a very, very important and successful program. We also have an FGCU and Lee Health internship program for social work through the social work department at FGCU. We have a postdoctoral fellowship program that we are beginning to look into, and we're beginning to hire a psychologist with training in that area who knows how to set up postdoctoral fellowship programs. And finally, we continue our work with the Florida FSU postdoctoral program in health psychology, from which we recruit heavily to staff our psychology positions, both in the adult and pediatrics direction. So I'm happy to discuss these and other things that we're working on, but now I'd like to introduce my good friend and colleague, Michael Nyachev, who's the Vice President of Governmental Affairs, who will brief you on our legislative initiatives. Thanks very much.
Thank you very much, Dr. Simeone. I appreciate that very much. To all of my esteemed colleagues here, thank you for the work that you're doing in the community to help advocate for Lee Health. I want to touch on a number of the things that we are specifically doing that you all can help us with as well to reach out to our legislative partners. And I want to say that over the last few years, we've identified key behavioral health legislative priorities to help meet the needs of our region, not just of Lee Health. Some of those priorities include expanding telehealth and other treatments. During the COVID-19 pandemic, we learned that the flexibilities that were provided to us to extend telehealth well beyond the physical borders of any particular healthcare facility or region were very important to get services to people that needed them where they needed them, and we need to continue to be able to do that. The federal public health emergency is going to be ending in the relatively near future, and when that happens, we'll need to codify a number of those things in the law, and we're going to ask for your help to advocate for those priorities. That additional flexibility has been proven to show better outcomes, and it can also help us with reducing the rising workforce shortages that we're facing, and Dr. Simeone had touched on. We're also looking for, as an additional priority, equal treatment and insurance payments for those telehealth visits. So when you physically see a doctor versus when you are seeing a medical doctor or another provider via telehealth, you're going to see a difference in that reimbursement, which could increase the cost for the patient themselves. And so we want to make sure that we're doing everything we can to keep the cost low for patients and remove any limitations that might be in the way of those patients receiving that care. Equalizing specialty behavioral health and general medical benefits will not increase total health care costs, and it's only a very modest amount on the overall premium. The real cost lies in not treating behavioral health disorders, and for those patients ending up as either Baker Acts or in our emergency departments. We want to make sure to address that with intensive outpatient therapies on when they need it before they end up in that scenario. Addressing the healthcare workforce shortages, pursuing action that will reduce workforce shortages, including modifications to graduate medical education funding, licensure, reciprocity, grant and incentive programs for the nursing workforce, and ensuring the visa authorization process is structured to expedite admission of qualified international medical staff. So we're doing a lot of the things here at Lee Health to bring in the staff that we need from other, not just here in the United States and training more docs, but from other parts of the world to make sure that we are creating access for the patients in Southwest Florida. Florida right now is ranked 42nd in the nation when comparing the ratio of patients for each mental health provider. We need to do better, and we're working to accomplish that. By 2035, Florida could face a shortage of 59,000 nurses and 36,000 physicians. Graduate medical education is something we do well in the state. We need to keep funding it, increasing it, and expanding it. Supporting for funding for critical programs, we've actually been working for projects to be funded by the Florida legislature, and oftentimes those must be done as either standalone bills or community funding requests. Both in Congress and in the Florida legislature, we have pursued specific programs for the Golisano Children's Hospital. I'm going to touch on those briefly. One of those things that we're looking to do is the Golisano Children's Hospital Down Syndrome Clinic, with the mission of improving the quality of life for about 5,000 children with Down syndrome and their families, offering coordinated assessments, connections to resources, education, and advocacy. Children with Down syndrome usually have delays in physical, intellectual, and language development. They require specialized services to help them reach their full potential. Supporting the Golisano Children's Hospital Autism Testing Demonstration Project. This project is going to give us the opportunity to expand what we're doing with the overall Autism Center request. So for decades, it was thought that autism spectrum disorder could not be diagnosed and treated until a child was about 3. Now, screening tools can identify children and risk at 18 months old or even younger. So early detection is key to being able to help these children and set them on the right path. The Autism Center's goal will be to serve as a medical and social services treatment facility for children and young adults with autism spectrum disorder. We'll be able to link early intervention, screening, healthcare services, and treatment, along with behavioral health education and vocational community partners. The most direct way to accomplish these projects is with legislative advocacy. And changing our government policy is something we can't do alone. So as our Vice President of Government Relations, I work every day in this space, and I need you all to know that as a community, we need to work together to be able to get these things done. And so we're here today with the ask that you be able to follow up with us so that we'll have a landing page on our website and the ability for you to connect with us so that we can support these projects and do more for behavioral health care access here in Southwest Florida. And so by sending these direct letters of support that my team has drafted from the Kids Minds Matter website, you'll be helping us to bring support to those families in need. I'd now like to invite Dr. Larry Antonucci, President and CEO of Lee Health, back up to highlight the ways our community can join us in accomplishing real change to meet the mental and behavioral health needs of this region. Thank you.
Thank you, Michael, and thanks to all our panelists here today. It seems like you can't turn the news on today without seeing one crisis or another around the world. And many times it leads to frustration when you ask, what can I do about this? So we're here today to let you know that we have a crisis right here in our community, and we need your help in overcoming it. The mental health epidemic is real and it is growing, and we're working to address it. We really do need you. As Michael mentioned, sending direct letters of support to your elected officials to ask them to address this crisis is really critical in our ability to deal with it. We have to expand coverage that's impacting our community's access to quality mental and behavioral health care. You can donate to Kids Minds Matter. As you heard before, a lot of the things we're doing are not supported by reimbursement, and they're only supported through philanthropy. The expansion of care, the mental health navigators are possible through this type of effort. Every dollar that's given is invested in these programs and services for our children and our families. And these issues are real. The story that Alyssa told about a 5-year-old child who is concerned about his family's well-being, that is one of thousands as we face financial issues that are going on. We have children whose parents have died from COVID, and they're facing real challenges. And we need every mental health navigator that we can put into our community. You can host or attend a community education course run by our child advocacy program. It's vital that we continue to educate the community to care for those with mental health challenges. Have the tough conversations and share mental health resources with someone in need. There is a list of partner agencies on our Kids Minds Matter website. Help is available out there. So talk to your friends and neighbors about it. This month, Kids Minds Matter launched My Story Matters. Join us in breaking the stigma associated with mental health by sharing your mental health journey and that of your family. This is for people of all ages, and you can remain anonymous. There are compelling stories for some very brave local youth advocates on the website. You can learn more about all these things on our Kids Minds Matter website. It's kidsmindsmatter.com/act-now. We need your support. And at this point, we'll be happy to take any questions. Holly?
I don't see that we have any questions. I don't see that we have any questions from our viewers online. I do see a couple comments. One that I wanted to address. We have a question or comment about LCSO being involved, being trained, and how to properly deal with children that they come across. I don't know if one of you wants to speak to that, but I think that's worth noting because you do have so many partnerships with Lee County.
LCSO folks are trained in CIT, which is the crisis intervention training that's designed by NAMI and is nationally and evidence-based, and they have been for quite a while. So that is something that's already occurring.
That's wonderful. There was a concern about that. Any media here with us today that have questions? Liz?
Yeah, how many navigators you have in schools? And second, do you have a breakdown of how you kind of use $5 million unless you find students?
We have currently 7 navigators. We're in the process of hiring an 8th, and those are split between Lee and Collier school districts, and then we have a navigator in the healthcare network, which primarily does a lot of work down in Immokalee.
And the $5 million that hopefully will be coming from ARPA will be used over the next 4 years. We have to spend it between now and 2026. And really, the monies will be divided between Lee Health. What's going to happen is we're going to create a new 501c3, a new entity through which the monies will flow to Collaboratory, United Way, Lee, and FGCU to create a totally integrated regional mental health system. So, single point of entry. If you have mental health services, people will call them. United Way will manage all the referrals. What will happen after that is the patients will be seen where they need to be seen. We will put together a regional case management collaborative, which will be undergirded by a closed loop referral system. So everybody who's in the circle of care will be able to talk to one another for the first time. It's going to be based in Lee. Over time, we'd like to regionalize this. Collier has their own 5-year mental health strategic plan, which I actually participated in as the Lee representative. They've done great work down there. It's not as comprehensive as what we're putting on the table here. This closed loop referral system, which will also leverage, we created a couple of years ago between Lee Health and Salis Care, we created a multi-agency release form, which allows every agency who's signatory to that to sign, have the patient sign that. And so all the information can then be shared through this closed loop system. That was a huge piece of work that we got done prior to all of this. And so we're going to manage the population using the best principles of population health. And I think, again, this is going to be a lot of work to put together because it's complicated. There's many aspects of this that need to be figured out. FGCU is going to do all of the measurement. We will report regularly on the whole set of evidence-based metrics that we're going to use so that we know who's doing what and how well and how we can improve services. Collaboratory will do all the community organizing, which they're excellent at. So this is really exciting. This is exactly what the region needs. And we have really good support. By the way, we have 42 letters of support from agencies that are supporting our application. So it's a big deal. Thanks for asking.
I'm going to take additional questions, and I just wanted to let you know I'm going to repeat your question for the benefit of our online followers who can't hear the questions from the media. Mary?
Hi, can you speak to the range of kids that you're seeing in the emergency room with mental health issues in terms of ages, and also what other kinds of problems do they come in with besides, like you mentioned, the 5-year-old? Can you just give us an idea?
So the question was the ages and types of chief complaints that are coming in with the kids you're seeing, types of cases.
Sure. So as I mentioned earlier, we have seen as young as 5. So that has been our youngest thus far that has come into our hospital under the Baker Act, up towards the age of 18. So it really is, we're seeing a wide variety of ages coming into the hospital under Baker Act for a multitude of reasons. Now, not all of these children are coming in because they have attempted to harm themselves. Some of them are. Some of them require medical treatment for those purposes, and others are coming in just because they expressed that thought. Do you have anything to add?
We also have seen a group of patients that are over 18 with developmental delay or autism. And as a community, we really do not have the infrastructure to take care of these patients when they go into adulthood. And that's something that we need to work on in developing a center for individuals with developmental delay and autism.
Other questions? The question was to compare the Child Baker Act numbers from before the pandemic to now.
Sure. So as I stated earlier, in 2019, for that entire year, we saw 288 children that came through the doors of this hospital under Baker Act. We are on track to see over 1,200 this year. So that really demonstrates the drastic increase that we've seen. I think Richard had
you had a
something to
comment?
say. Yes.
I just wanted to mention that also Kids Minds Matter, we forgot the navigator that's here at the hospital. And so one of the things we have seen, just like the school system saw these very high-end at-risk kids and families that were unable to access the system, we were seeing a number of kids who would come back repeatedly to us under the Baker Act. So we have now a navigator who is following and providing wraparound services, the same model, that national model that we're using in the school system. We now have somebody working here in the hospital that's they identify through social work those kids that have come here a number of times, and we'll follow them and try to prevent that cycle and really help them navigate and access all the services that people have been talking about. That just started this year, but it's going incredibly well.
We do have an online question, and folks are even answering their own questions here. So who is leading the Collier County 5-year strategic plan?
That was created through a consortium of people in Collier County. But Scott Burgess, the CEO from DLC, headed that work group.
Great. I also understand the Collier Coalition of Healthy Minds.
Yes, that came out of that.
Okay, wonderful.
Yep.
Thank you. Mary?
I just wanted to know, other than kids coming in through the Baker Act with thoughts of harming themselves or having tried to harm themselves, are you having kids come in simply because they're severely depressed and they can't get access to any kind of psychiatric or psychology services in the community?
So the question was, other than kids coming in for Baker Act, there kids coming in who are severely depressed who can't get help from other resources in the community? Good question.
The answer to that is yes. Some of them go to the emergency room, but most of them call our behavioral health office for appointments. And as you heard a year ago, we had over 600 patients waiting for help. We've brought that number down to 86 as of last Friday.
Yeah, and I would add that if you look at every metric we have of well-being, whether it's emotional, spiritual, physical, psychological well-being, for both kids and adults, every measure shows a dramatic increase in symptomatology. Mostly depression and anxiety. Domestic violence is up quite a lot, I think, because families are stressed, and not all families are well equipped to spend as much time with one another as they've had through COVID. Substance use disorder is up. Violence is up. Trauma is up. Suicidality, we've already spoken about. On the adult side, opiate overdose deaths have just crossed 108,000 year to date by the CDC measures. We've lost all of the gains we made since 2018, likewise with the suicide rates. So what I like to say about this time that we're living in is there is an enormous amount of ambient stress in the culture coming from virtually everywhere. And the fact that people are so symptomatic, I think, reflects that. So we're in a tough spot.
In our Golisano primary care offices, we also screen for depression starting at the age of 12 once a year.
Mhm. Other questions from our media?
I just wanted to comment on, the increase that we're seeing in pediatric behavioral health. You only have to look at what's happened in the nation in the last few years and what kids are seeing and experiencing to appreciate that. We see what's going on around the world. We see the footage from Ukraine daily, and as adults, we sort of, unfortunately, we desensitize to it. But an 8-year-old does not do that. An 8-year-old sees this and it impacts them dramatically. When they see 10 people shot in a grocery store, how do you think it affects them the next time they go to the grocery store with their mom? I mean, again, we can put it in perspective and say, it's a once in a million occurrence. But for a 7-year-old, it's very real to them, and it's scary. And the coverage for COVID that they've seen over the last few years and what hospitals have looked like and the reports that they hear of people dying every day, this is scary stuff. And as a community, we have to wrap our arms around our children and talk to them and explain to them and help them through these crises. We can't just shrug our shoulders. It will not just go away on its own.
Thank you, Larry. Other questions, comments?
What is something that a parent or a teacher could look out for starting today? Some maybe general sign or
Mhm. The
We
que-
always want to look for the, you want to repeat
Yeah,
the question?
I was just going to
Go ahead,
restate the
sorry.
question real quickly. So what are signs? This is super important, so I just wanted to make sure to cover this. What are the signs? And Dr. Keelan's going to speak to the signs.
Thanks for the promotion. I'm a mental health counselor. Um, um, we really want to look for a change in functioning. When we see a decrease in functioning, so any child that all of a sudden you're starting to see their grades go down, their attendance go down, any area, you really want to ask the question about what's going on here. And these days it can commonly be a mental health issue is interfering with their functioning. You know, if that's what we need to always look out for, it may be a medical reason, it may be something, but when you see a kid's ability to get through the day, to live, laugh, and love, if that starts to slide, that's what we need to pay attention to.
Good question. Other questions? Okay. We thank you all for being here.